Welcome to Balanced Body Podcast. My name is Dr. Brent Anderson, physical therapist and Pilates specialist here at Polestar Pilates and Physical Therapy Center in sunny Miami. Today I wanted to talk to you a little bit about working with athletes, particularly elite athletes that have suffered from a major knee injury. And just before we get them back into playing basketball, playing football, or soccer, I want to show you a couple advanced exercises on the Pilates chair. So I've asked Jamie to come with me and help me with this exercise. And this is called the lunge on the chair. And one of the things I'm looking at particularly is the alignment of the knee. And one of the most common problems coming back from an ACL reconstruction is that we lose our bone rhythm or our arthrokinematics. And let me explain that just for a second before she starts. What that is that the femoral condyles here that sit on top of the tibia are angled in a way that the medial condyle is larger than the lateral condyle. So as the knee starts to move from flexion to extension, there actually is a spiral or a rotation that takes place deep in the knee. And this is a great exercise to be able to reproduce that or to facilitate that in our clients. So I'm going to put my hands on top of her knee and on her leg as she does this exercise, demonstrating, I'll voice over exactly what's going on. So as she comes up into extension, the femur spirals in and the tibia spirals out. As she goes down into flexion, the femur spirals out and the tibia spirals in. And it's just reproducing this natural bone rhythm that exists that often is forgotten in these particular patients coming back from an ACL reconstruction. As we advance this, we can make sure that knee's coming forward now. I'm going to have her come all the way up, transfer that weight onto the leg, and then back down through. That's right, she just made the correction. And again, come on up. Feel that tibia spiral out as you shift that weight. Good. And then back down, femur spirals out, tibia spirals in. Very important point. Now we're going to move on to mountain climber, which is a great strengthening exercise for stabilization. So I'm going to put her knee in a safe position and then have her moving that back leg forward and back. Remove her hands so that they're forward and have her just repeat that. Let the pedal come up a little bit higher. That's it, and push back down. So it looks like the work might be happening here, but in reality the work is happening inside the leg, stabilizing over this knee in a nice position. And I can change that angle, come up a little bit higher on that leg, stop, and do the mountain climber there. So we can change the angle where we think there might be the greatest weakness and challenge that leg in that range of motion. Very good. Come on down. So just hope you have a little tip. Remember to think of that mechanical rhythm, that bone rhythm or the arthrokinematics of the knee coming back from an ACL reconstruction. And you'll be surprised that it's not always about strength as much as it is about alignment, one of Pilates' most basic principles in movement. Have a great day and look forward to seeing you at the next Polestar and Balanced Body Podcast.